We often hear statements about movement being medicine, or if we could bottle physical activity, wouldn't it make a great pill? We hear a lot about the benefits of staying active, but how do we operationalize that? How much should we do? Of what particular type of activity? Finding the balance between overdoing this and maintaining joint function can sometimes be quite tricky. We strongly advocate for the role of physical activity, but oftentimes we don't explain well how to do that. The purpose of this episode of Joint Action is to dig down into that core treatment option of physical activity, unpack it a little bit, and hopefully make it so it's practical suggestions that you can operationalize. To identify the benefits, but also hopefully give you tips around behavior change and prescriptions for making this part of your daily life. We take excerpts from previous episodes in an effort to try to distill that information into one compact episode that will give you this information. We're going to start off with Dan White. He joined us in season 1 in episode 17. So if you want to go back and listen to the full content, do so. But we spoke about a lot of different topics, but in particular, what types of physical activity were most helpful, how much physical activity should a person aim to do and at what intensity, and were there any tips or wearables that he could recommend that might allow a person to identify if they're getting the required number of steps per day and the right intensity. And then, if you've been sedentary your whole life, sometimes it's really hard to change your behavior. But how do you start? And how do you best succeed in sticking to that plan?
Oftentimes, a person, when they have osteoarthritis, complains that it hurts when they move. But what evidence is there that physical activity is actually helpful rather than harmful, which is, I guess, part of the common community perception?
Yeah, it's no doubt that in the short term, movement can be uncomfortable. It can hurt, especially for people with osteoarthritis. There's no doubt that happens. And actually, I was recently listening to a podcast that talked about some of the benefits of physical activity from the person's perspective of why do they stay active. And it came out, at least in people who are midlife, it seems that the short-term benefits, the very short-term benefits, are those that people find to be most valuable, such as, like, after you work out, you have this you're in a good mood, you can reduce the stress and those sorts of things that are very short-term benefit. You feel relaxed. And, unfortunately for osteoarthritis, especially when you start, it's going to hurt. No other way of saying it. It's not going to be, you don't get that short-term pain relief immediately after exercise, and likely it's going to make it a little bit worse. The good news is that if you can push through over that hump of the short-term pain, the long-term benefits, or I'd say perhaps more mid-term benefits, are substantial, especially for people who have a chronic disease. And for people with knee osteoarthritis, specific to them, the pain reduction on a midterm basis approaches that you get with medication. It's the same reduction in pain, but without the side effects, especially with the opioid crisis, just trying to get off of meds is huge. And exercise does that at the same level or same effect. There's also major strength gains you have with exercise, as well as just the ability to function. That is, get out of bed, get out of a chair, climb the stairs, without difficulty or with less difficulty. So for OA, there are substantial gains. And in general, actually for exercise, there's really known general benefits, including cardiovascular health. It's mood stabilizing. It's a good prevention method for weight gain. In other words, it helps maintain your weight. And, overall, if you could package it in a pill, it'd be a blockbuster drug. So we haven't figured out how to do that yet, but we know how to get there with the hard work.
That's great, and I'm looking forward to doing it. Looking forward to when they actually do that. But now, just to pull that apart a little bit further, you mentioned that when they first start, it might actually hurt a little bit more. Is there any pain that a person should be more wary or cautious of, where they maybe should say, slow down, back off? And is there any good pain that people should be cognizant of?
Yeah, that is a good question. I think the pain is a very personal thing that is not my area of expertise. Clinically, I tell people, if you wake up the next morning and your knee is still bothering you, you probably have overdone it. Immediately after, it's going to hurt. That's understandable, but then it should start to subside. And, within 24 hours, you should be back to baseline. After 24 hours, you might have pain, but that could be muscle soreness, the sort of delayed muscle soreness you get, which is actually really good pain. That's the type of thing you want to see, because that means your muscles are growing. There's an investigator in Australia who took a look at how much walking is a safe amount for people with sort of advanced osteoarthritis, and found that you can walk up to 70 minutes a week or 10 minutes each day without an increase in pain in the midterm. So I find that, that's on the smaller end of studies, but I find that as a good sort of rule of thumb for people starting out, saying, well, how much can I do? I'm really nervous about it. The 10 minutes is a nice benchmark for people that, for most, that will not substantially increase your pain and not do so on the long term.
Yeah, and this may not necessarily be consistent with exactly what you've said, but I think the short-term immediate pain the day after, if it's specifically adjacent to the joint and it's sharp, that's probably what Dan's talking about there, as opposed to pain in and around the joint and the muscles around the joint, which is probably a good sign that you've actually done some work. So what types of physical activity are most helpful?
Yeah, I think the first thing, sometimes I find it's good to just define what physical activity is, so we're all on the same page. And basically that is just any energy expenditure above a resting amount. So any amount of that you are doing something that involves more than sleeping or sitting. So that's physical activity. And exercise is included in that, certainly. And then when you talk about physical activity or exercise, there's obviously several different sort of attributes about it. First is the intensity of it, like how intense are we looking at things? And in general, we describe these as being light intensity, such as maybe standing, a moderate intensity that would include walking at a comfortable pace, and then a vigorous intensity, such as climbing stairs. Then beyond that, there's the duration, so how long you're doing these activities for. So that's just a sort of quick primer on how we think about physical activity. And obviously, there's many different types. And what I say to people is find something you enjoy to do. There's not one magic physical activity that is superior to another. It is, I think the real special sauce is finding something you enjoy and just doing that repeatedly. Again, understanding the notion of what is the intensity of that activity and then what is the duration of that, knowing that the more intense you can do it, the more health benefits there are, and the longer you can do it, the more health benefits they are in general. People with osteoarthritis often worry, though, that this notion of vigorous intensity could be damaging to the joints, or even a moderate intensity. And we really haven't found the moderate intensity to be damaging to the joints. We have found actually the opposite, that the more time you spend in this moderate intensity activity, the less likely you are to have something like even a knee replacement. We found this looking at large data sets. And as well as that the benefits of the moderate really outdo the benefits of the light intensity, though the light intensity is still beneficial. Anyway, so the people standing at home saying, well, what do you want me to do? I mean, the basic thing is walking is the most common physical activity that people use, that adults use to be active. Believe it or not, going for a walk is a moderate intensity that really hits the mark. And my doctoral student, Jason Jakila, just published an editorial in Journal of Rheumatology that in respect to this COVID pandemic and people wondering, you're social distancing, you're not going out, what's the minimal level of activity that we should really get? And his editorial talks about how it's 10 minutes a day. 10 minutes a day for OA is what we should be doing. And whether that's walking, whether that's doing some sort of exercise, that's the minimal amount you want to be hitting on. And again, finding something you enjoy and doing that is kind of what we recommend. So sorry for the long-winded answer, but that's kind of how we're thinking.
No, I think it's really, really helpful advice. Obviously, some people who may not necessarily like to walk, are there any other types of physical activity that you might advocate for people with osteoarthritis?
Yeah, sure. I mean, the common ones are getting into a pool. I mean, that is certainly less compressive force on the joints, and being in the water just feels good anyways. And doing any sort of water aerobics is a very low impact type of activity people do. And then on the other hand, biking is another thing, whether that is a stationary bicycle or a recumbent bike, that's something else. But I think I have to say, and this kind of comes from my CrossFit background, that it's not only the type of exercise you're looking at, but it is the social context that you're doing those activities in. And certainly there's some of us that are more the lone wolf type of people that we just like to do it by ourselves and just leave me alone. I want to put on my podcast and listen to this podcast or listen to music or something and just do it on my own. Great, knock yourself out. But for a lot of people, it's very much a social endeavor. And CrossFit has actually done a great job with the community aspect of exercise. So finding a group of people that you like to go for a walk with is a very powerful mechanism to maintain in the long term a healthy regimen. And so, maybe there's something with like yoga or Tai Chi or something that maybe is a stretch for you, but if there's a group of people or friends that you can get to join you, or maybe just even one friend that would be willing to join you, or that does this and you ask to join them, I mean, that is just a really fantastic recipe for success.
That's great advice, and hopefully people will walk away and use that very practical input to make a difference. You've already kind of touched upon this in terms of how much physical activity a person osteoarthritis should aim to do and at what intensity. It sounds like, on the basis of what you were saying before, that the minimum should be about 10 minutes a day, and aiming for that moderate, vigorous physical activity. And I'm all about setting realistic goals and making sure that people start slowly. But if they wanted to do more, is that likely to be more helpful? And if so, is there any evidence to suggest the more that we do, the better the gains that they'll make in terms of function and mood and body weight and things like that?
Yeah, no, that's a great question. All the literature in physical activity was nicely summarized in this sort of national report here in stateside called the United States Physical Activity Recommendations. And this is every 10 years that experts in physical activity meet along with other experts from the medical field and epidemiologists, and they try to put together, what's the state of the art for physical activity literature and what recommendations can we make from that. And the number one recommendation that they've said since the inception of this has been some is good, more is better. It's just the simple notion of what we call in science a dose response, or the more you do, the more benefits you're going to get from this. So as a starting place, we say 10 minutes, but even if it's 5, that's better than 0. So, starting someplace is going to be better than doing nothing. And then building from there, some of the benchmarks that what we have seen in our lab, there to be a dose response, or the more you do, the better off you are. And specifically what we've seen that in is the more steps per day people take, the better functioning they are, or the less likely they are to have problems with their functioning in the future. If you're looking for a number that is a sort of healthy amount of walking to maintain, we found that people who walk 6,000 steps per day were much less likely to develop problems with their functioning than people who walk less than 6,000 steps per day. But that's, again, you can go over 6,000 steps per day as well. And for people who do less than 6,000 steps per day, you're at 5,000. Again, that's better than 4,000. So, that's certainly something to consider. So I hope that answers your question with regards to dose response, or to, how much, but that's how we kind of think about it.
No, that's really, really practical advice. And I think it's going to provide a lot of insights for people who are out there. Now, are there any other tips or wearables that you might like to recommend that might allow a person to identify if they're hitting the number of required steps per day and the intensity?
Yeah, I think the literature on this has been around for a little while, and there's this really nice meta-analysis, or this paper that combined a whole bunch of studies and said, okay, what's the deal? What's going on here? And that paper basically found that the first step is actually just using a monitor. If you're interested in losing weight, if you don't have a scale, it's pretty tough to do. So the same thing with physical activity, having a sense of like, well, where am I? Measuring that objectively is really important. So having a monitor that counts your steps is a really practical way to get a sense of where am I on that scale. The next thing that this sort of summary paper found was that having a goal is a very strong way to increase activity. It's one thing to just see where your activity is, or similar to your weight, to see where your weight is, but where do you want to go? What feels like a good number to you? We throw out the number 6,000 steps per day as an ultimate goal for people, but if you're starting at 1,000 steps, that could be pretty daunting. So then maybe your goal is at 2,000 steps, or saying, hey, I want to walk 500 steps per day more. There's no one way to do it, but the main thing is to get the monitor and start creating yourself a goal. There are many different monitors out there. It's really a patient's preference, however, what feels the best for you. Some are hip worn, others are wrist worn. Your cell phone has a pedometer on it, believe it or not. You just have to go and search for it. So if it's on you, it will count your steps. It's completely up to your preference which one you'll use. But I find that using that step count measure is a very practical and understandable way to help increase your activity from a walking perspective.
Now, one of the common scenarios or questions that I face in clinical practice is a person comes along and they say, I've been sedentary my whole life. And it may not necessarily be completely sedentary, but I've never done any sport, I've never done any physical activity, and I've been quite happy. I'm now in a position where I've obviously got joint pain, and that's disabling me, and some simple activities of daily living are really, really hard to do. Where do I start, and how do I best succeed in being adherent?
Yeah, well, I think coming to that realization is actually a big step too. I think that deserves a pat on the back. To come to the point where you're making a decision to say, hey, you know what, I've been sedentary, but I want to do more. It is a notable stage in behavior change, or in that journey of becoming more active. So good for those people who made that decision. Now the question is like, okay, I've never been active before. What do I do? And I think this is where I kind of go back to the things that I talked about before, is identifying what are those activities that you like to do, and understanding that physical activity is anything above rest. What are active things, whether it's gardening, whether it's swimming, whatever, in actually partaking in those activities is going to be a huge step, getting people from being sedentary to being, minimally active, or being more active than they were before. I like to put in a plug for physical therapy, and seeking a physical therapist to help you along that journey is an important step. And what I mean by that is it's very common for people with osteoarthritis, and especially the sense that disease is such a long-term disease, to have chronic problems that they need a little help with talking about pain. I have pain that's specific, then I'm unsure whether this is good pain or not, like we talked about at the beginning of our podcast, or I'm unsure how much to push myself. And and those are very fair questions, very reasonable. And having a physical therapist work with you through those things is just a real practical way for them to get you started. And again, as I said before, with a telehealth and contacting someone, you might not even need to go into the clinic physically. You can do this over a video call, or even over the telephone. So, leveraging a physical therapist to help you with that is incredibly important. I guess the last part is, finding a partner to help you in that journey, finding somebody who will walk with you, or who will go bowling, or somebody who likes to go to the pool. And even if it's just a couple times, like finding that person who will give you support and accountability is a tremendous, tremendous asset. But again, I do want to circle back to what I started with, is, recognizing that, people who have come to that point, who have been sedentary but have decided that they need to do something, is a very good place to be, and definitely worthy of a compliment and acknowledgement. And now it's a great place to be, to take that next step of becoming more active.
That's great, Dan. And after all of that, I think I'm going to sign you up as my coach so that I get more physically active myself. It's really inspirational.
A quick note before we dive into the second half of this episode. We love getting your feedback on things that we should focus on, what we're doing well, and ideas for new topics to discuss. These mainly come through our email on hello@jointaction.info, but we'd love to hear more through our Twitter account @jointactionorg. There, you can hear from your fellow listeners. We can have a lively discussion about new topics and what questions you might have. So again, that's jointactionorg on Twitter, and we look forward to hearing from you. And obviously, if you have a friend that has arthritis and you think they might benefit from the show, please recommend it to them. The next content is brought to us by Mariana Wingwood, and Mariana joined us in season 3, episode 12. Now, oftentimes you'll hear people wonder about many aspects of physical activity, but have you ever had good plans to wake up in the morning and go for a walk, only to find that you were not as enthusiastic when the time came to do so? We know it's hard staying active. So Mariana helped us to unpack tips and tricks for staying active. More specifically, how much physical activity do you need? What guidelines there are around physical activity? How you should actually get enough exercise and what barriers there may be to doing so, and how you can overcome those barriers, and tips for increasing your exercise, but also individualizing that according to your particular needs. How much physical activity do older adults need?
So any physical activity is good. It used to say that people should do at least bouts of 10 minutes of activity at a time. But really, any movement is good movement. The goal of having about 150 minutes of moderate intensity activity. You can also do 75 minutes of vigorous activity, or combining those two in an aerobic form. Then it's really important to incorporate muscle strengthening at a moderate or greater level, and that should be done twice a week or more. And, those pieces are actually the same for older adults as well as younger adults. For older adults, it's also really important to include what they call multi-component physical activity. And that really just means emphasizing balance and strength training that helps complete functional tasks throughout the day. And that should be done 3 days a week, which sounds like a lot. But the important piece to remember is that physical activity can be interwoven throughout the day. Physical activity can include gardening. It can include going for walks with friends. It can include carrying groceries, which tend to be heavier. So all those pieces are counted for that.
Yeah, no, that's really helpful practical advice. Just to unpack a couple of the terms that you use there so we can help to identify a little bit more what they are. So you mentioned, at least for moderate physical activity, that you'd advocate 150 minutes a week and vigorous 75 minutes a week as a minimum. What would you translate the moderate and vigorous into? Given that people probably look at those terms and they don't entirely know what they mean, what level of intensity and what types of activity might be related to those physical activities?
Yeah, so the type of activity really depends on the person. People sometimes use heart rate to tell what is moderate versus what is vigorous, but an easier version of doing that is doing what's called a talk test. And that's simply meaning talking while walking. For example, if you're doing walking as a aerobic activity, and a moderate intensity walking is that you're able to talk but can't sing. So you're able to have a conversation, but you wouldn't be able to sing along while you're walking. While more vigorous intensity is you can say a couple words, but you need to take a breath before you finish your sentence. So you can't really finish a full sentence. So that's called the talk test, and that's an easier way of determining what's moderate versus vigorous versus light, where you could sing and walk at the same time.
Yeah. How many people do you see singing as you do exercise when you're out there? No, I'm just kidding.
Sometimes I sing them to get them to do exercise because I'm such an awful singer that people are like, oh, stop, I'll do the exercises.
Oh, that's brilliant. Brilliant. Now, you've done some wonderful work looking at what a proportion of adults actually get enough exercise. How many adults in the study that you did are actually getting enough exercise? And I guess with that question, how generalizable do you think that is to the broader community?
Yeah, that's a great question. So the study we did is among USA citizens. So I want to emphasize that. And among them, when we look at all three pieces, so the aerobic piece, the strengthening, and the balance piece, 11% completed all three of those components as recommended. And then when we broke it down to just looking at aerobic, just looking at strengthening, and just looking at balance, 39% did the aerobic piece, and 26 performed just the strengthening, and 41% performed the balance activities. And because in general, the data aligns pretty well between the US physical activity data and the European physical activity data, it aligns pretty well. I think it's pretty generalizable outside of the US regarding what they do. And research shows that, the number one activity most aging adults do is walking, no matter what, which was a piece that we also found with our study.
Yeah. So that's really helpful because obviously it gives us a baseline as to, where we're at with regards to physical activity prescription, so to speak, and adherence to the goals that we might like to set. Now, in addition to that wonderful work that you did, you also did some tremendous work looking at the impact of COVID-19 and some of the barriers that introduced to people being active. Can you just tell us a little bit about that work?
Yeah, COVID-19 impacted everyone in various manners. And unfortunately, one piece that's been shown is that with those low levels of achieving physical activity, COVID-19 actually decreased the amount of activity done among aging adults. And in the study, it was adults 50 years and older. And one thing we found out that among those that had a reduction in physical activity during COVID-19, some of the reasons for that were surprising and some were not too surprising. The not too surprising one was really to do with not having access to places to go work out. A lot of, things were shut down. People couldn't go to the gym. They were afraid to go to the park, even to go get their physical activity, which is not surprising at all. The other one that's not really surprising is difficulty to being committed to physical activity. It is known that a lot of people try to be active and start being active, but remaining active can be challenging, especially when other things come up. So that was another piece that we found during our study. Moving on to the more interesting findings was one of the physical activity barriers we identified to be associated with a reduction in physical activity during COVID was actually feeling anxious about physical activity. And initially we were like, oh, this is interesting. And then we thought about it some more. And it makes sense that a lot of people were anxious about not only being physically active, but being physically active in a space where other people are around, being physically active where they may increase their risk of having or obtaining COVID or being exposed to COVID. So it makes sense that anxiety related to physical activity impacted their ability to be active. The other fascinating finding was that actually people who self-identified, so they are people that said, I have a heart or lung associated diagnoses that is impacting my ability to do physical activity. And people who reported a fall over the last year actually were less likely to do less physical activity. So they are more likely kind of to remain active during COVID and didn't really change their physical activity during COVID. And we were like, oh, wow, this is fascinating because these individuals usually actually are less likely to be active prior to COVID. So we thought about it and why that may be. In the physical activity research, there's a lot of information about why does some people decide to be active and some people not to be active. And that's all explained by theories and models and other ways of representing that decision. And, one of those models is called the health belief model. And within the health belief model, they have found multiple factors that make someone decide if they're going to be physically active. And for the population who has self-identified having a diagnosis related to cardiac or lung issues, those individuals have higher perceptions of having a risk of having an illness that's get worse if they don't do something about it. They also have this perception of, if they don't do physical activity, I am going to be in trouble. I need to stay active. They also perceive greater benefits in physical activity. They also may get more what's called cues to action. And those are really stimuli that can be internal. So internal stimuli is something like, if I'm not active, I have more shortness of breath. So I need to stay active so I don't have shortness of breath. Or if I don't keep moving, if I sit here all day, I'm going to have stiffness in my knee. So I need to keep moving so I don't have stiffness in my knee. Those are kind of internal cues to action. And external cues tend to come from family members, healthcare providers, media. Those are the cues. Hey, you have a diagnosis that really benefits from physical activity. Don't forget to remain active. So kind of those pieces all align and make sense why someone with such a diagnosis would be less likely to be less active or more active during COVID-19. And I know I just unpacked a lot of information there.
No, it's really helpful information because, Mariana, I think for a lot of people, they probably understand a lot of the barriers that you were referring to there. And they relate quite well to some of the issues that you described there, whether it be, access to spaces and places that you could be active, challenges with other health complaints, potentially limiting their ability to remain physically active. So, with all of that in mind, how can we address some of the barriers that you've identified? And, any practical tips that you might have for people who are wanting to try to improve their exercise or physical activity?
Yeah. I think my number one advice is that physical activity is so individualized to the person. There's no one intervention or one recommendation for all. And part of it has to do with what is your personal goal, and identifying that personal goal and writing it down is really important, not just saying it out loud. Writing it down and talking to friends about it, because that makes you more accountable to accomplish that goal. And when you write down a goal, it's so important to also make it specific, such as what are you planning on doing? Add a number to it. If your goal is to be able to dance at your granddaughter's wedding, saying that, hey, I'm going to be able in 6 months at my granddaughter's wedding, I'm going to dance for 2 hours. That's my goal. So it's really specific. And that goal is also measurable. How do I know if I accomplished that goal? And then creating smaller goals to get up to it. Let's say you're having trouble moving for, more than 5 minutes at the moment. Have a weekly goal of increasing your movement by 1 minute in total and slowly work your way up to it, just breaking that task down, because sometimes having such a large goal is overwhelming, and overwhelming does not help anyone with accomplishing anything. So, that's really the first part, is to write down a goal that's really meaningful to you and not someone else. And then try to work towards that goal, those smaller goals, and figure out, is there something that's stopping you from those goals? Is it the barrier of not having access to something? Is it the barrier of you just don't know how to be physically active, or whatever it may be? And a lot of healthcare providers, exercise experts can help you overcome those goals if you are not sure of the solutions, because those really need individualized solution and problems solving. But you can also try to think of some options yourself, resources or recreational places to go be physically active is a really common barrier mentioned. But as I said earlier, physical activity isn't always I'm going to the gym. That's exercise, which is part of physical activity. You can do physical activity in your living room. You can move some of the coffee table aside and do some dancing, during a commercial break of a TV show you're watching. Turn on your favorite song and just dance to it in the living room. Whatever it may be that you enjoy, just incorporating it that way and trying to be creative. There's no wrong or right in this. So it's just really all about you.
No, it's sensational advice, and hopefully people can pick that up. And for people who want to, I guess, dig in a little bit more to some of the concepts that Mariana was talking there about setting goals and behavior change, please take a listen to one of the episodes in the library from Shannon Maholko on behavior change strategies. Now, one of the important concepts that you spoke about there, Mariana, was really this needs to be about you and your personal goals. And some of the challenges that people face are probably looking at the laundry list of what their colleagues and friends and clinicians may be advising them to do, but that doesn't relate to them. So how might you think better in terms of getting people to individualize some of those physical activity interventions?
Yeah, I think one way is to prioritize what is important to you and what needs to be accomplished to achieve what's important to you. May that be the dancing at your granddaughter's wedding, may that be walking a 5K with your daughter, whatever that is, it really needs to be personalized to that person. Another piece is that we can modify all physical activity to accommodate whatever that person needs are. So we talked about how walking is a really common form of physical activity, but not everyone can walk, and that's okay. You can do things like standing and marching in place during a commercial ad, taking 1 minute up and just marching in place is a great way to modify for going from a walk for 10 minutes. So it's really figuring out what works best for you and what you enjoy. And it's also important, especially if pain is present, pain interferes with a lot of physical activity in general. It's important to find something that is not going to irritate you, down the line, like in a couple hours or the next day. For example, power training is becoming really big among older adults, and really working on that force of being able to react, especially if you have a loss of balance. You have to be able to step quickly in order to recover. So some older adults, have been starting talking about plyometrics, which is like jump training and doing agility ladders and lifting things really fast and adding a lot of power to that. And that's not always the best thing for that individual. But it's important to remember that, power has two pieces. It has a force and a velocity. And you may not initially be able to do the force piece, but you can focus on a velocity. And then slowly, as you get stronger, incorporate more force. And physical therapists are great individuals and exercise experts to help you kind of figure out how you can modify these things if they don't work for you. But in the end, the main piece is, what is your personal goal and how can you accomplish that goal?
Yeah, that's really superb. And I'm, again, really hoping that people take away a lot of this practical advice. And I guess particularly just to emphasize the last point that you were making, Mariana, there, that if people are struggling with technique or suggestions, please go along and visit your local physical therapist, and hopefully they'll be able to provide you some practical advice. So if you're out there and you've been wondering about how to stay physically active, hopefully this gives you some tips and tricks for doing so. The intent here is to try to promote positive behaviors, to really put those core treatment options for osteoarthritis in your hands so you can operationalize them. We're hoping you found the content of today useful. Look forward to your ongoing support. Thank you so much for listening. And between now and when we next speak, please do take care of yourself.
Thanks for listening to Joint Action with David Hunter. If you like our show and want to know more, visit www.jointaction.info. If you have any questions, you can email us at hello@jointaction.info and follow us on Twitter @jointactionorg. This podcast was hosted by David Hunter, edited by Vicky Duong, music produced by Jordan Hunter. The information posted on this podcast is not intended to diagnose, treat, cure, or prevent disease. Anyone seeking medical advice should consult a health professional.